Welcome back to the Deep Dive. We've got a really interesting set of notes here today, all about goiter.
That's right. It's a term most people have probably heard, but the details behind it, pretty complex. So we're going to try and unpack this material together.
Yeah, our goal is basically to sift through these notes and really get a handle on what goiter is, why it happens, and what can be done about it. Sort of cut through the medical speak.
Exactly. Get to those core insights. Because while the name's familiar, the sheer variety of causes and types, even the symptoms, it's surprisingly broad.
And understanding the thyroid gland itself is key, isn't it?
Absolutely fundamental. You can't really grasp goiter without understanding that little gland. Shall we dive in?
Let's do it. So, starting with the basics.
Yeah.
What is goiter, according to these notes? The fundamental definition.
Okay, so at its simplest, goiter is just an abnormal enlargement of the thyroid gland.
That gland at the base of the neck, right?
Precisely. That butterfly-shaped one, just below the Adam's apple. An enlargement. That's the core definition.
Okay, seems straightforward. But the notes make a really critical point right off the bat about hormone levels, don't they?
Yes, and this is super important to get up front. The gland can be enlarged, that's the goiter, but your thyroid hormone levels, they could be totally normal.
Oh, right.
Or they could be high, which is hyperthyroidism, or they could be low, hypothyroidism.
So the swelling itself doesn't automatically tell you if the thyroid is working too much or too little.
Exactly. It's a physical sign, but the function could be anything. Normal, overactive, underactive. It's a starting point for investigation, really.
Got it. That's a crucial distinction. It's a physical clue that needs more digging. And speaking of digging, the notes break goiter down into different types, which seems helpful for understanding the why.
Definitely. These types point towards the underlying cause. So the first one, often called simple goiter or non-toxic goiter.
Simple or non-toxic.
Oh, right. This means the thyroid's enlarged, but it's not linked to hyperthyroidism. So hormone levels are normal or maybe even low.
And this simple type, it can look different.
Yeah.
The notes mention diffuse and nodular.
Yeah, good point. Diffuse means the whole gland is swollen, sort of smoothly. Nodular means there are lumps, nodules within the gland. Could be one lump, could be many.
And what causes this simple type specifically?
The notes link things like iodine deficiency. That's a big one. We'll come back to certain substances called goitrogens, and even genetic factors to this simple, non-toxic kind.
Okay, so simple means enlarged, but not overactive. What about when it is overactive?
That's the toxic type. Here, the goiter is linked directly with hyperthyroidism. The gland is enlarged and producing too much hormone.
Examples.
Graves' disease is a classic one mentioned, or something called toxic multinodular goiter, conditions where you get both the swelling and the overactivity.
Makes sense. Then there's the more serious category, malignant.
Right. Malignant means the enlargement is actually due to thyroid cancer. The notes list specific kinds like papillary, follicular, medullary carcinoma. So definitely something that needs identifying.
And the last type mentioned, inflammatory.
Yeah, this is caused by inflammation of the gland itself, thyroiditis. Examples given are Hashimoto's thyroiditis.
Which is autoimmune.
Right.
Often causes hypothyroidism.
Exactly. Very common cause of hypothyroidism, and it often presents with a goiter, especially early on, and also de Quervain's thyroiditis.
So looking at these types, it really shows goiter isn't one single thing. It's like a signpost pointing to very different underlying issues.
That's a great way to put it. A signpost. It could be nutrition, autoimmune problems, cancer, inflammation. It highlights that the enlargement itself is a symptom, not the disease.
Okay, that framework helps a lot. Let's dig deeper into those underlying causes then, because the list in these notes really shows how many things can affect the thyroid.
It really does. And the number one cause, globally speaking, according to this material, iodine deficiency.
The notes really stress that, don't they? Most common worldwide.
Absolutely. It's fundamental. Just lacking this one trace element in your diet is the leading reason people develop goiters across the planet. It speaks volumes about nutrition's role.
Wow. Okay, so iodine first. We touched on autoimmune disorders with the types Graves and Hashimoto's. Can you elaborate a bit?
Sure. With Graves, the immune system makes antibodies that basically mimic the thyroid-stimulating hormone, TSH. So they push the thyroid to grow and make too much hormone, hence toxic goiter.
So it's being stimulated by the immune system.
Right. With Hashimoto's, it's more of an attack. The immune system targets and damages the thyroid cells. This inflammation can cause swelling, the goiter, often before the gland eventually fails, and you get hypothyroidism. So two different autoimmune mechanisms, both potentially causing goiter.
Fascinating. And what about thyroid nodules? Are they always a cause for concern?
Well, nodules are just lumps in the thyroid. They're very common, and most are benign, meaning not cancerous. But if they grow large, or you have many of them, they contribute to the overall thyroid enlargement, a nodular goiter. A small percentage can be malignant, which is why they're investigated.
Now, this next one is really interesting, goitrogens, substances that interfere with the thyroid.
Yeah, isn't that something? These are things that can actually block the thyroid from using iodine properly or making hormones, so the gland tries to compensate by working harder and getting bigger.
And the examples, some are surprising.
They are. The notes mention foods like cabbage, kale, broccoli, soy, even cassava. But generally, this is only really a factor if you eat huge amounts raw and if you're also low on iodine. Cooking usually helps.
Okay, so it's context dependent.
Very much so. And then there are drugs. Lithium, used for bipolar disorder, and amiodarone, a heart rhythm drug, are specifically mentioned as potential goitrogens. It just shows how sensitive the thyroid is to what we consume.
Definitely.
What else is on the cause list?
Hormonal imbalances are mentioned, like during pregnancy or puberty. The hormonal shifts can sometimes cause a temporary thyroid enlargement, and genetic factors, some families just have a higher tendency towards goiter.
And finally, radiation exposure. Yes. Significant radiation, especially to the head and neck area, particularly in childhood, increases the risk of developing thyroid nodules and thyroid cancer later in life, which can obviously present as a goiter.
Looking at that whole list, it really paints a picture of the thyroid as this sensitive hub influenced by diet, genes, environment, our own immune system.
Exactly. A very sensitive barometer.
Okay, so we know the potential causes. If someone does develop a goiter, what are the typical signs or symptoms they might actually experience, according to these notes, beyond just seeing it, I mean?
Well, and the most obvious one is the visible neck swelling, like you said, or maybe feeling a lump or fullness there. And it could be symmetrical, the whole area looks puffy, or asymmetrical, more lumpy on one side.
And if it gets really big, that's when the pressure symptoms start.
Precisely. If the enlarged thyroid starts pressing on other structures in the neck, you get pressure symptoms.
Yeah.
The notes list specific ones. Difficulty swallowing, that's dysphagia.
Right.
Difficulty breathing, or dyspnea, if it's pressing on the windpipe. And hoarseness.
Hoarseness. How does that happen?
This is that fascinating detail. The notes explain it can happen if the goiter compresses a nerve called the recurrent laryngeal nerve. That nerve controls your vocal cords. So pressure on the nerve equals voice changes.
Wow. Just the physical size impacting a nerve like that. That's quite direct.
It really brings home the mechanical aspect, doesn't it? But beyond the physical bulk, the symptoms often tie back to the function of the thyroid, like we discussed with the types. So you often see thyroid dysfunction symptoms.
Okay, so let's separate those out. If someone has a goiter and hyperthyroidism, toxic type, what might they feel?
Right, so the notes list things associated with a ramped up metabolism. Losing weight without trying, feeling shaky or having tremors, a fast or pounding heartbeat palpitations, and feeling hot all the time, heat intolerance.
And the opposite, goiter with hypothyroidism?
Then you'd see signs of a slowed down metabolism, maybe gaining weight, feeling really tired or fatigued persistently, being intolerant to cold, feeling cold when others are comfortable, and having dry skin or hair changes.
So you really need to look at the whole picture, the swelling, plus these other body-wide symptoms to figure out what's truly going on.
Absolutely. The goiter is the clue, but the associated symptoms tell you about the underlying thyroid function.
All right, so we've got the what, the why, the potential symptoms. How do doctors actually diagnose this? What's the process outlined in the notes? It seems pretty systematic.
It is. It usually starts with the basics. A physical examination. The doctor will look at and feel your neck, palpate the thyroid, checking its size and shape, whether it feels smooth or lumpy, firm or soft.
Just getting the feel for it first, then what?
Then blood tests. These are crucial. They'll run thyroid function tests, TSH, T3, T4, to see how the gland is actually performing. Is it normal, overactive, underactive?
And those antibody tests.
Yes. Also key blood tests. Testing for anti-TPO antibodies helps diagnose Hashimoto's, and testing for TSH receptor antibodies points towards Graves' disease. So these help pinpoint why the function might be off, especially if it's autoimmune.
Okay, blood tests tell you function and potential autoimmune causes. What about actually seeing the goiter in detail?
That's where imaging comes in. The main tool mentioned is ultrasound. It's great because it uses sound waves, no radiation, and gives really clear pictures of the thyroid size, structure, and any nodules. It helps assess nodule characteristics. Are they solid, fluid-filled cysts? Do they have suspicious features?
Ultrasound first, and then there's that radioactive iodine uptake scan, the RAIU.
Right, the RAIU scan. This one looks more at function within the gland structure.
And this is where hot and cold nodules come in. Can you explain that again? Why is that important?
Sure. So you swallow a tiny, safe amount of radioactive iodine. Active thyroid tissue naturally takes up iodine to make hormones. A hot nodule on the scan is one that's soaking up more iodine than the surrounding tissue. It's overactive, usually making hormone itself. And the good news is, these are almost always benign.
Okay. Hot means active, likely benign. What about cold?
A cold nodule takes up less iodine, or none at all, compared to the rest of the gland. It's not participating in hormone production in the same way. Now, most cold nodules are also benign, but they have a slightly higher risk of being malignant compared to hot nodules. So, seeing a cold nodule often leads to further investigation.
Got it. That distinction is really helpful for assessing risk. And if there's a suspicious nodule, maybe a cold one on the scan or one that looks worrying on ultrasound.
Then the next step, according to the notes, is often a fine needle aspiration biopsy, or FNA. They use a very thin needle, guided by ultrasound usually, to take a small sample of cells directly from the nodule.
To check for cancer cells.
Exactly. Those cells are looked at under a microscope. It's the most definitive way to determine if a suspicious nodule is malignant or benign. So you can see the pathway, physical exam, blood tests, imaging, and then biopsy if needed.
Okay, that makes sense. A clear diagnostic path. So once you have a diagnosis, you know the type of goiter, the cause. What about treatment? What do the notes say about the options?
The absolute key message from the sources is that treatment depends entirely on the situation. There's no one-size-fits-all approach. It hinges on the cause, the size of the goiter, and importantly, the symptoms it's causing, if any.
So doing nothing is sometimes an option.
Absolutely. For goiters that are small, aren't causing any pressure symptoms, thyroid function is normal, euthyroid, and there's no suspicion of cancer, often the best course is simply observation, just keeping an eye on it with regular checkups.
Okay. What about medications?
Medications primarily target the underlying issue. If you have hypothyroidism, you'll likely get levothyroxine, that's synthetic thyroid hormone. Sometimes it's even tried for simple goiters to see if it helps shrink them, though that's debated.
And for hyperthyroidism?
Then you'd use antithyroid drugs like methimazole or PTU to slow down hormone production. And of course, if the cause is simply iodine, supplementation is the straightforward fix.
Makes sense. When does surgery come into play? A thyroidectomy?
Surgery is usually considered for specific reasons. The notes list. If the goiter is very large and causing obstruction, trouble breathing or swallowing. If there's a strong suspicion or confirmation of malignancy. Or sometimes purely for cosmetic reasons, if the goiter is extremely large and bothersome to the person.
Removing part or all of the thyroid.
Right. And there's also radioactive iodine therapy. And we mentioned the scan, but this uses a higher dose of radioactive iodine. It's a common treatment for hyperthyroidism, essentially damaging the overactive thyroid cells to reduce hormone production. It's also used after surgery for some thyroid cancers to destroy any remaining thyroid tissue.
And lastly, lifestyle modifications. Back to those goitrogens.
Yeah, the advice mentioned is mainly about avoiding excessive amounts of raw goitrogenic foods, particularly if you're already iodine deficient or known to be susceptible. Cooking often neutralizes the effect, though, so it's a nuance, but relevant for some.
So quite a range of treatments, really tailored. But what if goiter isn't treated, or it gets very large? Are there serious complications the notes mention?
Yes, and they underscore why getting a diagnosis and treatment is important. A major one, especially with huge goiters, is airway obstruction. The gland can literally squeeze the windpipe.
That sounds serious.
It is. Another critical one, linked to untreated or poorly managed hyperthyroidism, often toxic goiter, is thyroid storm. It's a sudden, severe worsening of hyperthyroid symptoms, very dangerous, requires emergency treatment.
Okay, airway blockage, thyroid storm. What else?
Well, looking after treatment, hypothyroidism is a very common outcome, especially after total thyroidectomy or radioactive iodine therapy. You then need lifelong thyroid hormone replacement. And finally, recurrence is possible if the underlying cause isn't fully managed, like if iodine deficiency persists or an autoimmune condition isn't controlled.
That really highlights the need for proper management. Before we finish, let's touch on prevention. The notes mention some strategies. Is there anything really effective?
Yes, and this is probably one of the biggest public health success stories related to the thyroid. The single most effective way to prevent the most common cause of goiter, worldwide iodine deficiency goiter, is iodized salt consumption.
Just adding iodine to table salt.
Exactly. It's simple, low cost, and incredibly effective. It's dramatically reduced goiter rates in many parts of the world.
That's amazing. Such a simple intervention. Anything else?
The notes also suggest regular thyroid screening for people considered high risk, maybe strong family history, other autoimmune diseases, past radiation exposure, and as we've said, avoiding excessive raw goitrogens if you're in an area with deficiency or have a predisposition. But iodized salt is the cornerstone for prevention on a population level.
Wow. Okay, stepping back from all the details. It's really clear that goiter is much more than just, a swelling in the neck. It's a signpost, like you said.
Definitely. Pointing to anything from a simple nutrient lack to complex autoimmune processes or even cancer, it's incredibly diverse in its origins.
And we've seen the diagnosis involves looking at function with blood tests, structure with imaging, sometimes checking cells with a biopsy. And treatment really has to be tailored.
Absolutely. No single pathway fits everyone.
It really makes you appreciate the thyroid's central role in, everything. Metabolism, energy, even how your voice sounds, and how sensitive it is.
It's a small gland with a huge impact on overall health. Understanding goiter really opens a window onto that.
So here's a final thought to leave you with, based on everything we've discussed. The fact that something as straightforward and inexpensive as adding iodine to salt can prevent the most common reason for goiters worldwide. It's just a powerful reminder of the deep, sometimes unexpected links between our environment, our diet, and the incredibly intricate workings of our own bodies. It really makes you wonder, doesn't it? What other simple, maybe overlooked interventions could hold the key to solving major health challenges?
A fascinating question to ponder. A lot to think about there.
Indeed. Well, thanks for joining us for this deep dive into goiter. We hope this helps make